Whenever someone asks us what is the difference between herpes simplex and herpes zoster keratitis, the first thing that comes to our mind is one has true dendrites and other has pseudodendrites. Okay, and something about the staining, rose bengal, and fluorescence staining, but somehow we forget that what is staining what and like that, because we are just memorizing the table and not understanding it conceptually. To understand why, even though it is a keratitis, the corneal sensations are reducing. Why one is staining with fluorescein, one is staining with the rose bengal. So today we'll learn it conceptually so that you don't have to memorize it ever again. So let's get started. Today we'll learn herpes simplex and herpes zoster keratitis conceptually. You have to understand the pathophysiology. So, herpes simplex keratitis, we have to remember epithelial destruction. The virus actively lyses corneal epithelial cells. Virus enters the cell, replication, cell lysis happens, and epithelial defects form. While in herpes zoster, there is a now inflammation plus epithelial cell swelling. Epithelial swelling. Okay. So, zoster reactivates, neuritis happens, denervation, and swollen epithelium happens. So, the true dendrite is the real ulcer. We can see here the ulcer. Epithelium here is gone. Physical gap in the tissue, and it has advancing age. So, this is the advancing age and terminal bulb. Okay, this is terminal bulb and advancing age, and we can see the branching pattern. Come to our question, why herpes simplex stains so well with the fluorescein? First, we have to understand what is the purpose and what is the mechanism of staining. Okay, so fluorescein dye stains spaces where there is a no epithelium. Okay, we'll understand this diagram. So as we can see here, epithelium has gone. Fluorescein dye will come and will stain the stroma. Okay, because there is no epithelial cell. Here we can see this one lining, but actually there is no epithelial cell, and it is directly staining the stroma. Okay, but here we can see the cells are there at the edges. Okay, and at the bulb. So whenever we can see the ulcer, here there is a lack of epithelium. Okay, so it is staining it. And rose bengal or lysamin green, it stays on healthy cells, devitalize or dying epithelium. Okay, so it stains epithelium, not the stroma. So epithelial cells need to be there for staining by rose bengal. Here the viruses are actively replicating inside the cells, so these cells are devitalized. So rose bengal stain will stain these cells where it is degenerated or devitalized. Okay, these cells are healthy, so it will not get stained. Okay, and here there are no cells, so rose bengal will not come here. So rose bengal will only stain the borders. Okay, so as we can see here, the rose bengal is staining the borders. Okay, and very faint staining or no staining at all in the base. Pseudodendrite is what? It is the elevated epithelial cells. Okay, epithelium is swollen and degenerated, but it is still there. Blunted ends. Okay, there is no bulb. Looks like dendrite, but the no terminal bulb-like thing is there. So the epithelium is raised but not missing. So why herpes zoster stains differently? As we have seen, the fluorescein will stain only where there is no epithelial cell. But here, epithelial cells are there. So very faint to minimum to no staining with fluorescein happens in case of a HZV, okay, herpes zoster. While rose bengal stains devitalized cells. So all the cells are devitalized in case of zoster. So we can see it is staining it uniformly. Okay, devitalized cell are there. Okay, so it stains it very clearly. As we can see, herpes pseudodendrite. Okay, the cells are swollen. So fluorescein will not stain here, but rose bengal will come and stain all over the dendrite. Now, why in case of a keratitis with herpes simplex and zoster, there is a pain as well as reduced corneal sensation? So it looks like paradoxical. Pain is there, but sensations are reduced conceptually. Why pain is present? Because mechanism is inflammation of nerve. Okay, nerve is irritated and inflammation is nociceptor activity and causes pain signal. While sensation is reduced due to nerve damage at the end organ. So the first branch of trigeminal nerve is coming and it's here it is getting inflamed. But the terminal branches are getting destroyed by the viruses. Okay. So here it is inflammation, here it is a destruction. Where there is a destruction, there is no sensation. But where there is inflammation, there is a pain. Okay. So we have to remember it like a burnt. Wherever you are burnt, okay, the burnt tissue has no sensation, but the surrounding area, which is red and swollen and tender, it has so much pain. Okay, so remember like that. So in herpes simplex, ulcer first, nerve later. So virus attacks epithelium directly, lysis and ulcer. So the sensations is going down first and the pain is coming later. But in herpes zoster, the nerve is getting affected first and the ulcer is later. So herpes zoster is very painful. But remember, the pain is usually around the one dermatome region and around the head and temple area. And so the patient with herpes zoster keratitis will complain of headache and pain around the lesion area. But the herpes simplex patient will have a reduced corneal sensation. But herpes simplex patient will not have this much pain. We summarize it in a one table. So in herpes simplex, lesion is true epithelial ulcer while it is a pseudodendritic elevated ulcer in case of zoster. Fluorescein is bright positive in case of simplex. It is minimal to negative in case of zoster. Rose Bengal is positive at margins while it is a positive all over in herpes zoster. Terminal bulbs present in simplex, absent in zoster. Dendritic ends are rounded bulbs. It is a blunted or tapered in zoster. Corneal sensation is reduced while it's markedly reduced in case of zoster. Pain is moderate, but it is a severe in case of herpes zoster. Skin rash, at all it is present, it is in the lip and face cold sore, but it will be there in case of a zoster. Treatment is topical or oral antiviral. Here, antiviral plus consider steroids. Okay. Slit lamp, what we have to look for? First, staining pattern. Look for staining. Bright fluorescent, real ulcer, simplex. Faint or absent, elevated only, think zoster. Terminal bulbs, rounded bright tips at dendritic end, simplex. Blunted taper, pseudo dendrites, zoster. Corneal sensation with a cotton whips or esthesiometer, markedly reduced in case of a zoster. Skin and history. So periocular vesicle in a dermatomal pattern, Hutchison sign, it's a herpes zoster until proven otherwise. So now can anyone tell what is this case? Write down in the comment what's this herpes simplex or zoster based on the staining pattern and the dendrite pattern. Write in the comments your answer. See you in the next video with a new concepts. Till then, goodbye.